Can a simple vitamin that thousands take every day actually be a silent killer? Imagine taking a supplement you thought was safe, only to end up in the emergency room with life-threatening kidney damage. That's exactly what happened to a 55-year-old woman, and today we're exploring her story. Stay tuned to learn what happened and how you can avoid making the same mistake. In December 2012, a 55-year-old woman was rushed to the emergency department. She had a history of kidney disease, but on this day, her condition had worsened dramatically. She was extremely weak, her heart rate had slowed down significantly, her body was swollen, and her temperature had dropped to a dangerous 93 degrees Celsius. This was well below the normal body temperature of 98.6 degrees Celsius, indicating something was seriously wrong. Given her history of kidney disease, doctors immediately checked her creatinine levels. Creatinine is a waste product that the kidneys normally filter out of the blood. High levels of creatinine indicate that the kidneys aren't working properly. Her test results were shocking. Her serum creatinine levels had skyrocketed to 3,530 milligrams per deciliter, mg/dl. This was a dramatic increase from her levels just 2 months earlier. Her kidneys were failing rapidly, and she had stopped producing urine. Without functioning kidneys, toxic substances were accumulating in her body, putting her life at risk. Recognizing the severity of her condition, the medical team moved her to the intensive care unit, ICU, immediately. She was placed on dialysis that very day to take over the job of her failing kidneys and remove the toxic substances from her blood. Dialysis is a life-saving treatment that filters and purifies the blood using a machine, doing what the kidneys can no longer do. The rapid decline in her kidney function puzzled the doctors. They conducted extensive tests to determine the cause. After thorough investigation, they identified an unlikely culprit, a common vitamin supplement that many people take daily. This seemingly harmless supplement had caused severe harm to her kidneys. This case highlights an important point. It's not always prescription medications that pose the greatest risks. Over-the-counter vitamin supplements, which many people assume are completely safe, can also be harmful. This woman's experience serves as a stark reminder to be cautious with any supplement you take. Here are some key points to consider to avoid making the same mistake. Consult your doctor. Always talk to your doctor before starting any new supplement, especially if you have pre-existing health conditions like kidney disease. Read labels carefully. Pay attention to the dosage and ingredients in your supplements. More isn't always better, and some ingredients can be harmful in large amounts. Monitor your health. If you start taking a new supplement, watch for any unusual symptoms and report them to your healthcare provider immediately. Research supplements. Not all supplements are created equal. Some may interact with medications you are taking or exacerbate existing health issues. By being informed and cautious, you can make better decisions about the supplements you take and protect your health. The story of this 55-year-old woman is a powerful reminder that even everyday vitamins can have serious consequences if not used properly. There are 5 vitamins that can be particularly hazardous if not used correctly. Today, I'm going to discuss the serious risks associated with certain vitamins for those with kidney disease. While avoiding all vitamin supplements can also be detrimental to kidney health, it's crucial to be vigilant about what you take. This incident is part of a broader pattern of hospitalizations caused by inappropriate vitamin supplementation. For example, a TikTok influencer recently developed kidney stones from taking vitamins to boost her immune system. Earlier this year, a 61-year-old man suffered excruciating pain that was initially suspected to be pancreatitis, but was later attributed to his vitamin supplements. Another alarming case involved a patient who experienced constant vomiting, severe leg cramps, and a dramatic weight loss of 28 pounds after just a month of taking excessive amounts of a vitamin, which ultimately led to the destruction of his kidneys. These stories underscore the importance of being well informed about the supplements you use, understanding the appropriate dosages, and being aware of the risks involved. Kidney disease patients are particularly vulnerable because their impaired kidney function prevents them from effectively eliminating excess vitamins from their bodies. This can lead to a dangerous accumulation, putting their kidney health at further risk. By understanding these risks and managing supplement intake carefully, patients can avoid potential health hazards and protect their kidneys from further damage. If you're a regular here, you might already appreciate the importance of being cautious with supplements, especially vitamins. Today, we'll dive into 5 vitamins that carry risks not widely known. Some of these can be harmful if taken in incorrect forms or dosages, while others pose a risk to individuals with kidney conditions. It's crucial to approach these vitamins with care. Vitamin number 5. Vitamin D. We'll start with the least dangerous and move to those with increasingly severe risk. Coming in at number 5 is vitamin D, a vital nutrient for kidney health. This might sound familiar, as I've emphasized its importance repeatedly. However, it's essential to manage your intake carefully. Vitamin D is fat-soluble, meaning excessive amounts can accumulate in the body, potentially leading to complications such as hyperphosphatemia, high phosphate levels in the blood, and hypercalcemia, high calcium levels in the blood. Both conditions are serious and can cause arterial calcification, where calcium deposits in the arteries, making them hard and narrow. In some cases, high levels of vitamin D can even lead to acute kidney injury. To avoid these risks, it's recommended to consume vitamin D in moderation. The ideal dosage is typically about 2,000 IU per day, combined with 100 micrograms of vitamin K2 and magnesium to prevent arterial calcification. This regimen helps maintain vitamin D levels safely. Sharing this information could be crucial for anyone with chronic kidney disease, so consider passing this video along. Don't forget to like it to help spread the word. We've also created a detailed video about the relationship between vitamin D and kidney health, which you can find linked above and in the description below. It can be alarming to learn about the potential dangers associated with vitamins we need, but being informed is far better than facing the consequences of ignorance, such as renal failure. Number 4. Cyanocobalamin, vitamin B12. Number 4 on our list of concerns is cyanocobalamin, the synthetic form of vitamin B12. Unlike its natural counterpart, methylcobalamin, cyanocobalamin is not derived from natural sources, but is manufactured for its cost-effectiveness. This synthetic version is commonly included in many multivitamins, making it widely consumed. However, its use can pose significant risks, particularly for individuals with chronic kidney disease, CKD. Cyanocobalamin contains trace amounts of cyanide, a fact implied by its name. While the body of a healthy individual can process and eliminate these traces of cyanide without any issues, the situation changes when kidney function is compromised. In individuals with reduced glomerular filtration rate, GFR, the ability to clear cyanide decreases, potentially leading to toxic buildup and accelerated kidney damage. Research has indicated that the metabolism of high doses of cyanocobalamin can lead to the production of small amounts of cyanide. For those with CKD, this could hasten the decline in kidney function. Therefore, individuals with kidney issues should be particularly cautious and opt for methylcobalamin instead. By being informed about the differences between cyanocobalamin and methylcobalamin, and by choosing the right form of vitamin B12, you can help protect your kidneys from further damage. Awareness and careful management of supplements are essential, particularly for those with CKD. The natural form of vitamin B12, methylcobalamin, is safer for individuals with reduced kidney function and is generally recommended at a dose of 6 micrograms daily, particularly for those on a plant-based diet. It's crucial to understand that vitamin B12 is poorly absorbed in its synthetic form, prompting manufacturers to pack these supplements with large quantities of cyanocobalamin, sometimes 100 times the recommended daily intake, RDI. Such high levels are intended to ensure adequate absorption, but they can also heighten the risk of cyanide accumulation in those with kidney impairments. While it's vital for those on a renal diet to supplement vitamin B12 to avoid deficiency, which could trigger severe health issues like vascular disease and anemia, choosing the right form and dosage is equally important. Habitual deficiency of vitamin B12 can lead to significant health complications, so supplementation is necessary but must be approached with caution to ensure safety. Individuals, especially those with CKD, should check their supplement labels meticulously to confirm they are consuming methylcobalamin and not cyanocobalamin. By doing so, they avoid the risks associated with cyanide while still reaping the benefits of vitamin B12, which is essential for maintaining good health. Number 3. Alpha-tocopherol, synthetic vitamin E. Continuing with our countdown, our third entry highlights a widely used vitamin that may pose significant health risks. Studies have linked this everyday vitamin to a range of adverse effects, including markedly increased blood pressure and an elevated risk for stroke and cancer. Additional research suggests it could cause bone loss, higher cholesterol levels, and even kidney damage across the general population. Despite these hazards, this vitamin continues to be produced and used in various products. It is important to steer clear of alpha-tocopherol, the synthetic form of vitamin E. If you are a regular follower of this channel, you might be aware that I consistently advise against supplementing with vitamin E if you have kidney disease. The issue with alpha-tocopherol is its pervasive presence in the market. It is added to everything from supplements to nutrient-dense powders, drinks, and food items. For individuals with kidney disease, the risk posed by synthetic vitamin E is particularly acute. However, vitamin E in its natural form may be beneficial. It is considered a potent antioxidant, and antioxidants are increasingly seen as vital in the management and treatment of kidney disease. Despite these potential benefits, I strongly recommend against supplementing with vitamin E unless your healthcare provider specifically prescribes it. This is particularly crucial when it comes to the synthetic forms of the vitamin. For those looking to safely incorporate vitamin E into their diet, the best approach is through food sources. Sunflower seeds, for example, are a nutritional powerhouse rich in natural vitamin E. Just 1 ounce of these seeds can provide up to 66% of your daily vitamin E requirement, underscoring their value in a healthy diet. While natural vitamin E has its advantages, the synthetic variant, alpha-tocopherol, carries significant risks and should be avoided. Be especially cautious with any supplements containing high doses of this synthetic ingredient. Always consult with a healthcare professional before adding any form of vitamin E to your regimen, particularly if you have underlying health conditions like kidney disease. Number 2. Vitamin A. Vitamin A secures the second spot on our list for its potential dangers, surpassing even synthetic vitamin E in terms of risk to kidney health. This essential nutrient, usually beneficial, poses significant risks when ingested in high quantities, especially for individuals with chronic kidney disease, CKD. Vitamin A is fat-soluble, meaning it can accumulate in the body to toxic levels if taken in excess. High doses of vitamin A can lead to a condition known as hypervitaminosis A, which can cause symptoms such as nausea, dizziness, headaches, and even more severe effects like liver damage, increased intracranial pressure, and bone thinning. For individuals with CKD, the impaired kidney function exacerbates these risks because their kidneys cannot efficiently filter out the excess vitamin A. For those with compromised kidney function, regular multivitamins that include vitamin A are not advisable. Common brands like Centrum, Smarty Pants, or Supradyn, popular in Europe, are examples of products that might be harmful under these conditions. The problem arises because damaged kidneys cannot effectively filter and eliminate excess vitamin A from the body. This can lead to a buildup of the vitamin, turning it toxic and causing severe health issues, including liver damage, birth defects, and accelerated kidney deterioration. Vitamin A toxicity is most commonly linked to the overconsumption of certain foods, notably fish liver. While incidents of acute kidney injury from dietary sources are rare, they underscore the need for caution. Overindulgence in foods high in vitamin A, such as certain fish livers, can lead to hospitalization due to acute kidney injury. This highlights the potential severity of vitamin A accumulation, emphasizing that even natural sources can pose significant health risks when consumed in large amounts. Moreover, the levels of vitamin A found in typical over-the-counter multivitamins can be unsafe for individuals with reduced glomerular filtration rate, GFR, a common issue in CKD patients. Because vitamin A can accumulate in the body, it is crucial for those with kidney impairments to manage their intake carefully to prevent toxicity and further kidney damage. While vitamin A is essential for health, its intake needs to be carefully monitored, especially in individuals with pre-existing kidney conditions. Number 1. The dangers of vitamin C. Taking the number 1 spot on our list is vitamin C. Let's dive deeper into the severe case of the 55-year-old woman who experienced catastrophic kidney damage, shedding light on a critical health issue related to a commonly consumed supplement. The central focus of her health debacle was none other than vitamin C, a supplement that many might not suspect due to its widespread use and essential health benefits. Among her daily routine were multiple supplements: calcium, digestive enzymes, cranberry, a daily multivitamin, vitamin D, and notably, vitamin C. Each of these played a role in her overall health strategy, but only one contributed to her swift and severe health decline. Medical professionals were initially puzzled by the rapid deterioration of her kidney function. The breakthrough came when a detailed kidney biopsy was performed, revealing extensive accumulation of oxalate crystals. This condition is uniquely linked to excessive intake of vitamin C. The daily intake of 1,000 milligrams of ascorbic acid, commonly recommended as a normal dose for boosting immunity and combating vitamin deficiency, proved to be a disastrous oversight for her weakened kidney condition. Typically, vitamin C is celebrated for its antioxidant properties, boosting the immune system, and even enhancing iron absorption. However, in her case, the high dosage turned harmful, with her body unable to process and eliminate the excess effectively. This incident underscores a broader health lesson: the necessity of moderating vitamin intake, especially in individuals with pre-existing health conditions or compromised organ functions. The oxalate crystals formed from the breakdown of too much vitamin C can lead to kidney stones in healthier individuals. For those already suffering from kidney issues, the consequences can escalate to kidney failure, as seen in this unfortunate case. Furthermore, this story highlights the importance of medical oversight when taking supplements, particularly for those with chronic illnesses. Patients with kidney disease or other significant health issues should consult healthcare providers before starting or continuing any supplement regimen to tailor their intake based on their body's specific needs and limitations. It is crucial for individuals to be aware of the symptoms that might indicate problems due to high vitamin intake, such as changes in urine output, sudden swelling, fatigue, and changes in heart rate. Recognizing these signs early can prompt timely medical intervention and potentially prevent severe outcomes. While vitamins are vital for health, their consumption must be approached with caution and responsibility, especially in those with existing health vulnerabilities. The case of the 55-year-old woman serves as a sobering reminder of what can happen when supplements are taken indiscriminately. It is a call to action for everyone to ensure they are well informed about their dietary supplements and to seek guidance from healthcare professionals to avoid similar health crises. This video has spotlighted why this particular vitamin ranks at the top of our list for its potential dangers. It might seem inconceivable that a mere 1,000 milligrams daily, a dose not unusually large, could result in catastrophic kidney damage. Yet, that is precisely what occurred in the case of a chronic kidney disease patient. This unfortunate outcome underscores why this vitamin is a prime focus of today's discussion. Many manufacturers recommend this exact dosage, implying its safety and necessity. However, the reality is starkly different and warrants a thorough examination. Most brands market vitamin C supplements suggesting a daily intake of 1,000 milligrams. This is the same dosage that the 55-year-old patient consumed, leading to severe kidney damage. This incident isn't isolated. It reflects a widespread issue across numerous brands that promote similar dosages. While many assume that vitamin C is harmless, the truth reveals otherwise. This story serves as a sobering reminder that more isn't always better. Even though a small amount can be beneficial, excessive intake can be harmful, especially for individuals with kidney issues. For those taking vitamin C supplements, it's crucial to reevaluate your dosage. While 100 milligrams per day might be adequate, escalating to 1,000 milligrams can be detrimental to your kidneys. It's vital to ensure that your intake doesn't exceed a safe threshold. If you're interested in understanding how to safely supplement with vitamin C, stay tuned to our channel. We're here to guide you through safe practices for supplementing vitamins, particularly in situations where kidney health is a concern. Vitamin C, also known as ascorbic acid, is water-soluble and generally excreted in the urine when taken in appropriate amounts. However, in higher doses, it can crystallize and not be properly excreted. This crystallization can lead to the formation of oxalate crystals, which accumulate in the kidneys and cause damage. Understanding the risks associated with vitamin C, particularly for those with kidney disease, is crucial for protecting your health. By being informed and cautious about supplement use, you can make better decisions that safeguard your well-being. The information provided here aims to help you avoid potential dangers associated with certain vitamins, ensuring that your supplementation practices support, rather than harm your health. Remember to share this vital information with others who might benefit from it. Thank you for tuning in, and remember to always be mindful of the supplements you take. For more detailed guidance on how to manage vitamin C intake safely, check out our next video. Until then, take care and keep your health a priority. Thank you for watching, and God bless you all.